Hello and welcome. Let's talk about venous ulcer or varicose ulcer or gravitational ulcer. So, what is it mean by varicose or venous ulcer? Venous ulcers or varicose ulcers are wounds that are thought to occur due to improper functioning of valves in the veins, usually of the legs. Most common site is leg. The venous ulcer of the leg characteristically develops in the skin of the greater region, the area side of the calf between the muscles of the calf and the ankle. The majority of ulcers develop on the medial side. Ulcers associated with lesser saphenous incompetence often develop on the lateral side of the leg. Venous ulcers rarely extend onto the foot or onto the upper calf. Causes: superficial venous incompetence, deep venous drainage, usually post-thrombotic. Clinical features: initially it is painful, but once chronicity develops, it becomes painless. Ulcer is often vertically oval. The edge shows a venous ulcer has a giantly sloping edge. The base contains granulation tissue covered by a variable amount of slug and exudates. The floor is covered with a pale or often without any granulation tissue. It often leads to scarring, ankylosis, Marrow ulcer formation. Slug from the ulcer bed may give way, causing venous hemorrhage. Periostitis is common, and amongst almost all venous ulcers have surrounding lipodermatosclerosis, which is the thickening, pigmentation, inflammation and induration of the calf skin. The inguinal lymph nodes are enlarged, usually vertical group. The differential diagnosis. The differential diagnosis of venous ulcer include ischemic ulcer, diabetic ulcer, rheumatoid ulcer, traumatic ulcer, neuropathic ulcer and neoplastic ulcer. The investigations. Discharge from the ulcer for cultural sensitivity, X-ray of the area to look for periostitis, biopsy from the ulcer edge to rule out Marrow ulcer, duplex scan to access the states of the superficial and deep veins, Doppler scan for venous and often arterial cause, full blood count can be done, ESR, CRP, sickle test, blood or urinary glucose to extra diabetes, RF factor to extra rheumatoid arthritis if associated with joint pain and swelling. Bipedal ascending phlebography will often detect obstruction and post-thrombotic changes missed by duplex scan. Now, treatment. Discard method of treating venous ulcer may be tried, which includes measures to reduce edema like increase venous drainage so as to promote ulcer healing. Elevation, massage of the injured area and whole calf, passive and active exercise can be done in this case. The care of the ulcer by regular cleaning with povidone, iodine, hydrogen peroxide can be done, and dressing with USMLE can be done. 4-layer bandage technique to achieve high compression pressure can be done, which is changed once a week, and antibiotics depending on culture and sensitivity of the discharge may be given. Once ulcer bed granulates well, split thickness skin graft is placed or pinch graft may be placed. The specific treatment for varicose veins should be undertaken, which includes Trendelenburg operation, stripping of veins, perforator ligation, etc. The complications: hemorrhage, Marrow ulcer, infection, talipes equinovarus, periostitis, disability, calcification may be seen. Now, differences between venous and arterial ulcer. The venous ulcer occurs over the middle aspect of the lower third of the leg, usually above the medial malleolus, but arterial ulcer occurs below the medial malleolus, particularly on the toes, dorsum of the foot or heel. Venous ulcer is painful, but the patient complains of discomfort, while arterial ulcer is painful. The history of the smoking is seen in case of arterial ulcer, where intermittent claudication is also seen, and the varicose vein is seen in case of the venous ulcer. Peripheral pulse is normal in venous ulcer but reduced or absent in arterial ulcer. The edge is sloping in venous ulcer but punched out in arterial ulcer, and the floor is covered by healthy granulation tissue in venous ulcer, but minimal granulation tissue covers floor in case of arterial ulcer. End of the topic.